Hello everyone. In this video, we'll be discussing on the topic of our ventricular tachycardia, that is VT, and sudden cardiac death. Okay, so these two pathologies are major complication of the diseases of many cardiac pathologies. Okay, so these are most common complications of many heart diseases. So what are the mechanism for the occurrence of arrhythmias? First, we have to see. Okay, so there can be abnormal automatism. So the meaning is that sinus node actually contains the main head of your impulse generation is your sinus node. Okay, so it is a pacemaker cells that are capable of generating impulses. So in the sinus node is the first area from where actually your the potentials, that is due to the entry of the sodium and potential. There's a physiological mechanism. When this actually activated, then the first impulse which is generated is in the sinus node. Normal, if we say normal heart rhythm which works, is sinus node. So they are capable of generating the impulse spontaneously. Okay, sinus node, then AV node, then their bundle of his, after that your Purkinje fibers. So these are the main pathway of the impulse generation. So this is actually called as normal automatism, as I told you. So what happens in pathology is other cells do not have high impulse to rate to generate the impulse. Like the impulse cannot be generated from AV node because their potentials are not as much as high as sinus node. Okay, so because of that there is no chances of to generate impulse from those reasons. But in case of like myocardial infarctions, heart cells outside the sinus node can provoke a rhythm disorders called anomalous automatism. So meaning is that if any impulse which is generated other than sinus node, that is as it is written, heart cells outside the sinus node, so that type of automatism is actually called as abnormal automatism or anomalous automatism. Okay, now what are the trigger activities we see? If the heart cells contract twice, although they were activated only once, so only one impulse was generated, but heart is actually contracted two times, then that condition is actually called as period tachycardia or torsade de pointes. Okay, so this is one of the pathologies. Now these two above pathologies are examples of impulse formations anomaly. Okay, now what is ventricular tachycardia and why does it occur? Now ventricular tachycardia is 3 or more consecutive beats at rate greater than 100 beats per minute. So in 1 minute, if your heart is beating more than 100 times, then that condition is actually called as tachycardia. But if there is conditions like 3 or more consecutive beats at rate greater than 100 beats per minute, so normally if one beat is actually out 100 beats, then you can say the patient has sinus tachycardia. But if it is occurring 3 or more consecutive times, then that condition is actually called as ventricular tachycardia. Now what is it is associated with changes in the heart muscle. If there is any changes in the heart muscle, this condition can arise, like in myocardial infarctions. Now VT can be of two types, monomorphic and polymorphic. So in ECG, in ECG, if you differentiate, you will see same rhythm and QRS at equal intervals. But in polymorphic, we will see irregular rhythm and QRS at different intervals. Now I will show you one ECG regarding this. So this you can see. So you can see the sinus tachycardia. You can see there are interval. So this peak points you can see these are actually R. These are R waves. So in between consecutive R's, you can see they are having equal distance. So from here to here, you can see two large boxes. These two large boxes, you can see this and this. So the consecutive, you can see only two. So they are equal intervals. So that is why it is called as sinus tachycardia. So when there is ventricular tachycardia, you can see no QRS complex. You can see no peak-like elevations. You can see. Okay, T wave is also missing. Okay, so that this ECG is actually of ventricular tachycardia. Here. So the two types, like polymorphic and monomorphic. So same rhythm, QRS at equal intervals, RR at equal, that is called as monomorphic. If at different intervals, that is called as polymorphic. So it is constant. And one more image, you can see this type of. So as I told you, this is the impulse generation point here. Then AV node, then your bundle of branch. Okay, right, left, and after that Purkinje fibers on the walls. This you can see. So this is the impulse. If the impulse is generated here, that is actually called as irregular impulse, because ventricles are not able to eject the blood properly. So if the impulse is generated this point or this point, anywhere else other than these sites, other than sinus node, here it is your sinus node, here in this region this is your AV node, you can see this pointed parts, and these are the fibers. These are bundle of branch and right and left side, and these are the Purkinje fibers on the edge of the walls of the heart. Okay, so this is actually the conduction of impulse. Now, what is sudden cardiac death? Now, WHO defines sudden cardiac death as sudden, unexpected death within an hour of onset and symptoms. Within 24 hours if death occurs, then that is called as sudden cardiac death. In this case, a person may or may not have previously diagnosed heart disease. So this can occur in patients without any past heart pathologies or with any heart pathologies. So it can occur any type of patients. Now in medicine, if you see the concept of SCD, that is sudden cardiac death, in case of sudden death of the patient with congenital and acquired or heart or any vascular diseases, or no obvious non-cardiac causes of death were found during the postpartum examinations. So there can be all the types of reasons for the sudden cardiac death, like congenital or acquired any heart pathologies or any vascular diseases of the heart, okay, coronary artery disease, myocardial infarctions, any vascular, any valvular pathology, valvular metal stenosis, anything can lead to your heart attack or any sudden cardiac death. Clear? Now, who is most likely to experience sudden cardiac death? Who are more prone? So, SCD is one case per 1000 per year. Okay, so one case you will see out of 1000. In adults, you will see in 1 lakh population only one. Okay, in children age 1 to 13, only one out of 5 cases you will see. In children, it is most common. Okay, and SCD is more common in men. History of the heart attack or cardiac arrest or MI increases the risk. So the patient who had previously, who has 1 or 2 years ago heart attack, minor heart attack, so those patients, or any type of cardiac arrest, okay, cardiac arrest or MI suffering from myocardial infarction, so they are more prone to the risk of sudden cardiac death or in the later on stage. So where SCD occurs most often, so 80% occurs at home. The patient who are at home has 80% chances, and 15% occurs at street or in public, and out of which 2 to 15% are hospitalized, others are discharged. So 2 to 15% are actually goes into serious conditions, and but others are other 85% are discharged. Okay, now causes of sudden cardiac death, like 80% cases have heart failure. The heart is not able to pump the blood. In that case, the patient can have sudden cardiac death. Cardiomyopathy, because of dilation of both the chambers, like ventricles are dilated, atriums are dilated, so cardiomyopathies, okay, not that. Cardiomyopathies are restrictive type, and all 3 types we have cardiomyopathy, so that is other case. And Brugada syndrome, that can lead to MI, as I told you. Aortic stenosis due to the narrowing of your aortic valves. The valves will not be able to close properly, open properly due to the narrow, so blood will be left in the other chambers. Due to that, there can be sudden cardiac death, or any chest injury, trauma, or any changes of heart muscles in athletes. You will mostly in a sports person, there are changes in the heart muscle due to major cardiac activity, cardiac load. Okay, so they work due to the cardiovascular activities. There can be changes in the heart muscle due to the activity, so they are more prone to sudden cardiac death. Now, how does SCD develop? So in SCD, we see VT and VF, that is ventricular tachycardia and ventricular fibrillation, are most common. Cardiac tamponade, we see rupture of any aneurysm of aorta and thromboembolism of any pulmonary artery. Okay, so these are the signs. So like this, you can see this plaques, that the blood is in this artery if this happens. So this can also lead to your sudden cardiac death. Okay, this was the ECG as I showed you, and this is an irregular impulse for the cause of VT, ventricular tachycardia. Okay, so this was ventricular tachycardia and sudden cardiac death. Thank you.